What is going on, guys? Thanks for tuning in to yet another video. My name is Anthony Pinto da Costa, and you are watching the Canadian Physio Student. Alright people, so I'm back again with another video interview. As you guys know from the last video interviews, during these interviews I sit down with some clinicians to discuss certain topics in physiotherapy in hopes of providing you guys with some clinical pearls that you can take with you and then subsequently apply them within your own practice. With that said, the topic of the day for this interview is the importance of patient education, which I'll be discussing with the one and only Graeme Leverette. Graeme, how's it going?
I'm doing well.
Good, yeah, I'm glad we finally get to do this. You were supposed to be my first or second guest, but you had a busy semester.
Busy fall.
Yeah.
Fall term last year.
So better late than never, which is good. So before I give you the floor, just tell people who you are. I'll tell the people how we know each other. So Graeme taught us in our first year, he taught us anatomy, and he also taught us our electrophysical agents course. And then we haven't seen him since, but at the end of this second year, he's going to teach us in our ergonomics course, which will be great. Great way to end off the program. And then last thing here is me and Graeme have actually lived parallel lives, but I won't get into it. I'll let him tell you guys about that. So before I talk too much here, I'll just give you the floor now just to introduce yourself, to the people who you are, where you're from, definitely where you're from, and everything else.
Well, thanks. So like as Anthony said, my name's Graeme Leverette. Anthony and I have had a similar history. I am a Western kinesiology grad from 2006. I'm a Queen's Physiotherapy grad in 2008. But most importantly, Anthony wants me to educate you that I'm from Georgetown, so we share the same hometown. Whereas Anthony says the greatest town on earth.
Definitely.
But hopefully more parallel things in the future.
For sure.
So I guess more details about myself. After graduating physiotherapy school, I actually started working at the on-campus physiotherapy clinic. I was lucky to have a student placement at the clinic, and it kind of worked into a future job and future career. So something to highlight, all of those placements are mini interviews going forward. So that's at the same time, so that's 2008, I also started working with the varsity athletes at Queen's. So I worked with Queen's Athletics and Recreation for 3 years, working with rugby and hockey, both rugby and hockey programs. And then for me, teaching and education has always been a passion of mine. I'm a child of two parents. My brother's I'm a child. We'll do that one over. I'm a child of two teachers, and my brother's a teacher, so education really does run in my family. And so I had a desire to be in the classroom assisting with the labs, and that kind of grew into teaching some full courses as a term adjunct and growing more experience in that. I've kind of reached another level this past summer. I've finally reached the status of being a continuing adjunct, so now an actual faculty member. It took about 8 years to get there, but it's been a journey, and physiotherapy's been great, and especially for me, I love being in the clinic and at the same time being able to share that in the classroom too.
Perfect. A lot of that I didn't know. I didn't know that you had a placement at the Queen's Clinic. So
Randy
was
my CI.
Nice. So that just shows do well on your clinical placements, and then maybe they can pay dividends in the end there for you. So perfect. So that's a good intro. I guess that now we can get into the meat and potatoes of the discussion, patient education. And I'll first start off by just saying that in school we learn that a good treatment plan consists of maybe some manual therapy, some hands-on work, some modalities if indicated, and then of course the king, exercise. And then we also do touch on education. But there's this whole how component, like you were talking about off camera, which I guess leads into my first question here, which is, what is patient education and why is it so important?
Well, I guess to the first part, patient education can be kind of a broad context, but I usually think about it as informing or educating the patient about their diagnosis and the prognosis of their injury, but also being able to, through our assessment, establish the strengths and deficits that they're exhibiting, and really communicating that, because often I think we will too often focus on the deficits, is like what's wrong, and it's really, I think Kyle would echo this and say how it's important to actually emphasize people's strengths and what they're doing well, and show how resilient we are. But more on the education side, it's informing them what are the possible treatment options that we're going to be presenting them with, as well as what their role will be in the rehab process, as well as my role, because it very much will be a shared partnership going forward. To the second point about the importance of it, though, I might go a little bit lengthy on this part. With the aspect of me saying that what is the patient's role in it is really the idea that they should be taking ownership of what their rehabilitation plan will be. And partly with that design is going to be what are their goals, what are the other contexts in their lives that might alter their rehabilitation plan, but really that they should be a part of the plan and not just me dictating what's going to happen.
Like an active participant.
Exactly. I had recently had another patient that kind of thanked me for not just saying what they should be doing, but what they should not be doing. So the idea of maybe something that they're currently doing in the hopes of getting better is actually keeping them injured. Maybe they're performing an exercise that's overly straining one muscle group that's actually the injured muscle group, and just trying to educate them why that might not be advisable at this time. We'll focus on targeting some of the muscles around that so they can continue exercising, but not keeping them in an inflamed state or an aggravated state. And then one thing I just wanted to mention recently, and I don't know if you read the Physiotherapy Practice magazine, but there is an article actually on patient education.
Oh, nice.
And one of the things that I think just definitely drilled home to me is the idea that this is a dialogue, and it's not a monologue. It is very much they are contributing to this. It's a teamwork to actually get the education across, but I'm going to have to change how I might educate a patient based on certain circumstances, or what their past history is with exercise, or what their past history is with their work. And so I guess in a nutshell, that it's a lot of like as itself is informing the patient of things, but also kind of informing them what is a benefit and what could be a negative as well.
Definitely. Yeah, I think to add to that too is like what you're saying about what patients should be doing or what they shouldn't be doing. I kind of see education as kind of like a rite of passage for some of these patients too, because some of them legitimately don't know what they should and shouldn't be doing. I had one experience on one of my placements. I was working with a guy who had a meniscus injury, and I saw that he was making good progress, and he should probably start doing some of the things that he was doing before, because he was a really active guy. And he was like, Anthony, like, I just want to know, like, can I go to the gym? And I'm like,
it can be
of course you can go to the
that,
gym.
yeah.
And he was like, oh my God, that's all I needed to hear. And like that was like a huge like eye-opening moment for me.
And that could happen every
Simple
day.
things.
Like even this morning, like another person who's gone through a traumatic neck injury is like, they're just fearful to move until you kind of give them the green light and say it's going to be okay, and we'll dose out a treatment plan at a slow level that is going to be challenging but not overtaxing. So it's really, people just want to know that it's okay to move.
Definitely. Yeah, I think that's all good points. Anything else to add to that question, or are we good to move on to?
We're good.
Okay, perfect. So one thing I've noticed just being on placement is working with CIs or just even observing other clinicians, you kind of see these tricks of the trade, some of these strategies that you only pick up on placement. It's one of those things that you learn out in the field. So that trickles into my next question here is, what strategies do you use to facilitate effective patient education skills?
I think one of the main ones that I consistently use is having the patient actually try to educate me back, so almost like a teach back method. Or if instead of just teaching me is like, how would you describe this to your partner or to a family member or a friend? Like, what did I say that you're going to probably say to your friends about what, or even coworkers, like what are you dealing with that you, or what do you understand about what you're dealing with, and how are you going to proceed about that? I think partly with it, it's also when during that teach back, it actually allows the ability to clear up any misunderstandings. Mm-hmm. So if the patient comes back and says, "Oh, I think you're kind of trying to tell me this," it's like, no, like you can't move. Like we might say that we want to limit doing an action for a week or two, but we definitely want to be getting back to that eventually. So it's not like that's a bad exercise for life, but I'd like you to limit that in the next short term. Mm-hmm. I think the other thing too with strategies is because a lot of my education is exercise based. That means I'm telling them what to do, but at the same time I'm often demoing what I'm doing. I'm cueing them when they're doing the exercise. I'll make sure that they leave with an exercise sheet as well, so they're seeing it in on many different kind of repetition. And repetition by far is very key to me, and it's even like. For any type of learning, it's like I want to see it written down on paper, I want to perform it, I want to feel what you're asking me to do, just to kind of get that kind of brain-body connection of what are you asking me to do and what should I be feeling. And for me, like when we're going, especially through exercise, I'm racking my brain often to try to say the right thing that's going to like connect with them so that they do the motion right. So whether it's like training to do like a simple squat into a chair, and I'll tell them like sit back as if you're sitting into a chair, like if I'm trying to load the hips more than the knees, and so those kind of eureka moments for the patients that you see what you said is creating a desirable change in their movement. Those are the things I'm like, okay, I'm writing that down so that you constantly think about that when you're reperforming this on your own.
Definitely. I guess all good points. Just before I move on here though, the teach back method, like I really like that method, I use it too. But just wondering from your own experience, have you ever used the teach back method and the patient kind of got defensive with you, maybe saying like, what are you testing me here? Right. Or is it pretty much a good success rate with doing that? You
actually will get a little bit of pushback. So it's kind of interesting that, because people don't like being put on the spot for many things. So when I kind of approach that, if I get any pushback like that, it immediately turns into like a re-education of like, okay, like me going back over some of the bullet points. And if they don't want to go through the teach back method, then it's kind of like, okay, I'll put that on the shelf. I'll definitely want to come back to it next time I see them. And say either they can prove to me that they understood through the patient education by performance. So I was like, oh, let's see those exercises, or tell me the changes that you've made in the last week or two that kind of echo the points that I had said before. So I don't need them directly to do the teach back verbally, but maybe through their actions in the next couple of weeks, they'll display that.
So for sure. Yeah, no, because I've had that experience before, and I was kind of like, taking it back.
Especially the first time you don't really know how to approach it. So you can basically just take the reins back and go back to the bullet points of what you want to.
Perfect.
Make
That's good to know.
Understand. Yeah.
Good to know. Just wondering there. Didn't want to be the only one who's actually experienced that. But anyways, I think we've basically honed in on how important education is and what strategies we can use to facilitate them. So my next question here is, what advice do you have for current PT students and new grads on how to develop effective patient education skills? So for someone like me who's about to enter the workforce, I definitely want to become proficient in this stuff. Right. So if you have any advice to share.
I think it'd be the same advice I give any students trying to learn anything, and it's really practice. Like practice as many times as possible.
For sure.
I think too, a lot of the times is we feel we know the answers up here, but it's like getting it out of our mouth and actually getting the patient to actually understand it at a level that kind of meets their knowledge base. I think with that idea of practice, I don't know if you remember this back from electrophysical agents, but one of the first kind of half-jokingly challenges, we talked about the pros and cons of heat and ice. And I said, when you go home this weekend for Thanksgiving weekend, have a great discussion at the dinner table and try to educate your family members about ice and heat and when and why not maybe to use them. And I don't know if anyone followed suit, but the idea is like those are great audiences for you to be practicing against. Like what might not be a good audience is your classmates. And I think you guys know this because you guys already know the answer, and so it's really, if you say anatomical jargon, they know it, like your classmates know what you mean, but maybe like a family member might not, and it's really trying to get to the meat and potatoes of what are the points that you're trying to get across. You want to make sure there's understanding there, and for me, it's always been about the simplicity of it. Even with my teaching in the PT program here, like I've always kind of based it around like a quote by Albert Einstein, which I don't want to screw up. But and he said, like, if you can't explain it simply, then you don't understand it well enough. And I take that to heart as myself in front of the class. If I feel like I was educating something and it either multiple questions came after it, or there's like glazed look over the class, like something wasn't communicated well enough so that the students could digest it. But the same thing is going to happen in clinic too. Like you're going to get glazed look over by your patients, and partly with it, it's getting into small, digestible, simple chunks, and that's something that takes practice of as well.
Yeah.
I'm trying to think if there's anything else to mention here. Absolutely avoid jargon as much as possible. We're not here to show off how much education we know, but really we're trying to educate them, the patients.
Yeah.
The other thing too is, and this is another thing when I'm in clinic, I'm constantly almost trying to create little analogies or small stories for the patient to kind of have a better understanding of what I'm trying to get them to do. And over like a 10-year career, I've developed some stories that I constantly go back to, and they work really well, but they don't work for everyone. And I'll have to tailor them to each patient as the circumstances arise, that maybe they don't understand that sport that I was giving an analogy to, or maybe their workplace doesn't require that sort of activity that my story talks about. So it's making those tailors, but I think a lot of people really love learning in small stories as well.
For sure.
So.
Yeah, I think the analogies are key, and definitely the simplicity component, not having that jargon in there. And like you were saying, like it's good to practice. Well, you have to practice with your classmates, but you kind of get into this cycle of just using that jargon that they understand.
Yes.
And then you actually go into the real world, and like I had this experience actually with my mom. She was having a shoulder issue, and I just said, just put your arm into abduction. She's like, what is that? And I'm like, oh, just go like this with your arm.
Yeah.
So like we really got to like bring it down.
And there's another thing with patient, that's the importance of demoing. It's like no matter what, if you should like display it, like you don't even need words to describe what you want them to do. So
definitely.
And sometimes words can take you the wrong direction.
No, all good points. Anything else to add to that in terms of the education component?
No, but practice is one of those things. It's because we talk about practice on placements a lot, and saying it's like, oh yeah, you'll take patient education and you'll be learning that across all of the placements in the PT program, but even still, like you sometimes only get small tidbits of exposures to like a certain injury and trying to educate about that, but it's something to even be thinking about when you're not on placement.
All the time. Perfect. All right, so that's good for the education piece here. And just my last question for you, I ask everybody who comes on here when I interview them, but just quickly before we end the video, apart from this patient education component, do you have any just general advice for current students who want to pursue physiotherapy in this day and age?
Not so much advice, but I think more informing people a little bit more about physiotherapy, because a lot of times we see physiotherapy as like the doers, and we're doing activity, or we're doing hands-on skills, but at the same time, like I can have an entire treatment session that's just education. And that I know that's the whole thing for them to commit to the future treatment plan that we're going to develop, or maybe there's a ton of fear there that they need to realize that movement is okay at this point. And at that point, early in my career, I used to think that like just education. It's like, oh, I got to do something still for this patient before they leave here. But the value is that education. Like you said, that's all I wanted to hear, that I can move and that's okay.
Sure.
So as long as you kind of understand that physiotherapy as a profession is very much education based, I think every little encounter is education. And there's not really any realm that you don't have patient education on some level. The other thing too is with physiotherapy as a profession, you kind of actually also have to have great exposure to a number of things. So whether it's just like a number of different sports, if you're working in a like private clinic that's doing musculoskeletal injuries, or if you're working more in a hospital settings, a number of different conditions that a patient could experience. But for me, it's like how often I treat like a figure skater or a gymnast, and I've never done those sports, but at the same time, trying to understand like what's biomechanically happening in that position, and how I can still give them something that would benefit them through a treatment plan. So I'd say just recognize that it's not all about our hands as a profession, and although I do love that video that you had with Jesse, because I think at the same time he mentioned that the ball's kind of going too far in the direction of being hands off, and I think there's great aspects of us being a hands-on therapy, but at the same time we are educators, and even when he's doing hands-on treatment, he's educating the patient why he's doing it and why it's important. So yeah,
perfect. Honestly, especially that point about getting a vast vast experiences, because you never know who's going to walk in your clinic. Like, people come from different walks of life, and if you have all these experiences, I feel like it's better, or it makes it easier for you to kind of relate to these people. So definitely the many experiences, I think, is really good. So anything else to add, or you think we're good here?
I don't have any more points.
Perfect. Okay. Well, Graeme, thanks for coming on. Really appreciate it. Hope you guys learned a lot from this. So if you like this video, make sure to like, share, and of course,
gently tap.
Smash that subscribe button. And I will see you guys at the next video.
Another day, another dollar to be made. I'm a workaholic, ballin' hard until the grave. Used to wanna be a baller for the NBA, till the fellas around me started dunking in the 7th grade.